Welcome back in, everyone. We're joined by Evan Netto and Danielle Gray, both registered nurses with St. Joseph Healthcare. Thank you so much for joining us today. And you both sort of specialize in wound care and this unique therapy of hyperbaric oxygen treatment. So talk a little bit about what this is.
Yeah, so thanks for having us.
Yeah.
Hyperbaric oxygen therapy, it's 100% oxygen, so a lot of people don't know what we're breathing right now. Mm-hmm. It's only 21% oxygen, mm-hmm. So we put people into a tube full with 5 times that amount of oxygen, mm-hmm. and then we pressure it down to about 50 feet of seawater to provide more oxygen to the tissue that needs it.
Okay, and why would why would folks need this? We sort of talked about this as you're treating the treatment. You know, patients are so focused on just treating and hopefully eradicating the cancer, they don't think about how the side effects of that treatment are going to mount up. So this kind of addresses that.
Yeah. So when patients have cancer and are treated with radiation, will sometimes damage the healthy tissue, which they see effects later on in life. They can show different signs depending on where the radiation is, bleeding in the urine, bleeding in the stool, wounds that just won't heal. Mm-hmm. So then they get referred to us and have these treatments that can vary from about 10 to 60, depending on their diagnosis and what the research shows. And these treatments can help cure their symptoms or make them better.
Talk specifically about how this is going to help patients feel better. So this rejuvenates tissue that's damaged kind of over the course of these multiple radiation treatments.
Yeah, so all depending on diagnosis and what they're there for. I mean, we have some people that come in for oral surgery too. So head and neck cancer that gets radiation to the head and neck, oral surgeons will refer them to us prior to getting dental extractions, mm-hmm. How they may see symptom resolvement in bladder issues or colon issues is hopefully seeing less bleeding in their stool or their urine. For the wounds, that's more objective. You know, you can see a mastectomy site that's been radiated, that's open. Traditional wound care has been failing. So driving that oxygen to the irradiated area, we can see it visibly, which is one of the coolest aspects of our job, to see visibly rather than just symptom-wise. Seeing it with our own eyes is very neat.
This must be incredibly fulfilling because cancer treatment is so onerous and it's scary on so many levels, and then you start feeling these side effects from the treatment that is saving your life but also causing you other challenges. So what is the feedback from patients that you get, and what is it like to assist with this and see this happen?
Yeah, so we see patients, multiple days in a row. Sometimes we see them 60 days in a row, 5 days a week. We get to have a good relationship with them, and they come in a little scared and they're like, I cured the cancer, now why? Why am I having this? So we can be there with them, and I don't think we've had too many negative remarks regarding our treatment.
Yeah, we're a very small team, and like she said, we have really good rapport with our patients, and we're right side by side, so as nerve-wracking as the treatment can be, you've got nursing staff right on the side of you, able to talk to you through a transparent tube. Mm-hmm. So there's a lot of things that scare people, and we try to make sure that we're with them hand in hand as they're in the chamber each day. And by the end of it, like you said, not only symptom-wise, but we develop some pretty neat relationships as a nurse to patient.
I would imagine that as healthcare professionals, those relationships are rewarding when you're helping people through probably the scariest time in their life.
Very much so. Very much so.
For sure.
Well, thank you for coming and sharing so much, sharing with us about this therapy. We really, really appreciate it, and I'm sure folks can just get a referral from a provider if they're interested in this therapy.
Absolutely.
Yeah, I would say if anybody has symptoms that they're curious about, talk to their provider, and there's FDA indications that we look at and do a thorough screening before.
All right, well, thank you so much for joining us and for the work that you do. We appreciate it.
Yeah, thank you.
All right, folks, stay with us. Your extended forecast is next.